Welcome to the Primewise Medicare Workshop Part 1. Your presenters are
Monica Braunwort, Primewise Coordinator.
and Janelle Delemba, Director, Primewise and Volunteer Services, St. Elizabeth Healthcare. We encourage to make sure that you are comfortable. If you have not already done so, you might want to print off this presentation so that you can jot some notes down. Additionally, we will be referring to handouts that are available to you on our website as well. You may want to look at those and print the ones that apply to your particular situation. Please note that any questions you have and contact the Primewise office either by calling or by emailing if you have questions that have not been answered during this presentation. We will have that contact information for you at the end of the presentation as well. So this particular presentation shares the basics of Medicare Part A and Part B only. Other important information that you will need to make any decisions about your Medicare coverage will include Part D prescription drug plans, Medigap or supplemental insurance plans that work with Original Medicare, other options, or another option to Original Medicare, which is called Medicare Health Plans or Medicare Advantage plans. All of those will be covered in the Medicare Part B. Medicare workshop. We do want to make you aware that the Primewise staff do not sell insurance and are not associated with any insurance company. We do not endorse or recommend any policies or plans. This is strictly intended to be informative. Medicare Part 1.
Medicare Part 1 workshop. We're going to talk about the Medicare card, Part A hospital insurance, Part B medical insurance, Medicare assignment, help for low-income beneficiaries, the Medicare summary notice, and your Medicare rights. In your handouts, I would recommend for you to go ahead and print out your credible coverage handout, your Medicare summary notice, and help with Medicare costs for people with low income. We will be discussing those handouts. What is Medicare? Medicare is a federal health insurance program run by the Center for Medicare and Medicaid Services, or CMS. Benefit decisions are controlled by the U.S. Congress, and Social Security Administration, or SSA, handles enrollment and eligibility for Medicare. And this was never intended to be the total solution for your Medicare needs. How to enroll in Medicare. You will get enrolled automatically if you are receiving a Social Security or railroad benefits check. You will receive your Medicare card 3 months before your 65th birthday. Enrollment is not automatic. If you are still actively working to enroll, you'll contact Social Security about 3 months before turning 65. You can visit the local office or call 1-800-772-1213, or you can go online at www.ssa.gov. If you're retired from railroad employment, you'll enroll with RRB, and you can call your local office, which is 1-877-772-5772. Once you receive your Medicare card, you're going to need to check your name to make sure it's accurate. And then the effective dates of Part A and B will be at the bottom of the card, and that's when you'll be able to use your Medicare card. And keep this card safe. Now, once you receive your Medicare card, when you receive the Medicare card form in the mail, you will do nothing to accept the Part A and B card or return it to refuse Part B. Follow the instructions on the back of the card form. Now, why would you refuse Part B? Well, you have a decision to make. If you don't have insurance coverage from active From active employment, you'll probably want to keep the Part B. If you do have insurance coverage through an active employment through yourself or a spouse, you may want to delay the Part B. There is no penalty if you enroll while you have coverage or within 8 months of losing coverage. HSA and Medicare. We always recommend checking with your company's Human Resource Department about your specific situation. If you have a high deductible health plan and contribute to an HSA or health savings account and continue to work past your 65th birthday for an employer with greater than 20 employees, you probably want to delay enrolling in Medicare Part A and B. You do not want to elect to receive your Social Security benefits either. To avoid a tax penalty on your HSA contributions, if you retire 6 months or less after your 65th birthday, you want to discontinue contributing to your HSA beginning the month of your 65th birthday. If you retire anytime after you turn 65 and 7 months, you will not want to make any contributions to your HSA for 6 months prior to signing up for Social Security and/or enrolling in Medicare Part A and B. If you'd like additional information about the HSA and Medicare, please go to our handout folder that is associated with this webinar and review or print out the HSA handout.
So now we're going to talk about Medicare Part A, or the hospital insurance portion of Medicare. And this is a portion that is funded by the Social Security Trust Fund. So most individuals who receive Part A receive so at no cost through their own employment or the employment of their spouse. So in order to qualify for the no cost, you do have to have been employed in a job where you contributed to the Medicare system through those FICA taxes, and for 10 years or 40 quarters. People who have less than 10 years or 40 quarters of coverage in a Medicare covered employment can pay a premium to get Part A, and that premium in 2021 is $478 per month. So what does Part A cover? Part A, as you recall, is the hospital insurance portion, so it does cover inpatient hospitalization. And it covers it in something called a benefit period. And you can kind of see at the bottom there, the yellow banner that says a benefit period begins the day that you are admitted to the hospital and ends when you haven't received any inpatient coverage or have been out of the hospital for 60 or more consecutive days. This is an important concept for Part A and how they pay. So just kind of keep that in mind. And this is being an inpatient. So for day 1 through day 60 of a benefit period, Medicare covers all costs except for $1,484. That is what is called the deductible, the Part A deductible. So they will cover all costs except for that deductible. And so you are responsible for that piece. And you're responsible for that amount of money, whether you are admitted for 1 day or you're there for all 60 days. It does not matter on the number of days, it matters on that benefit period. So for an example, say that you are hospitalized for pneumonia and you are in the hospital as an inpatient for 3 days. And you go home and you are home for 6 months, and then maybe you fall and break your hip and need to have some hip surgery. You are going to start at day 1 of the benefit period because you have been out of the hospital greater than 60 consecutive days. Because you recall I said 6 months. So you'll start again at day 1 and once again be responsible for that $1,484. But let's say that you are in the hospital for pneumonia and you're there for 3 days and you go home for 2 weeks and you fall and you break your hip and you're admitted to the hospital. You will start on day 4 of the existing benefit period because you have not been out of the hospital for 60 or more consecutive days. And you will not be responsible for any additional cost because you have already met or paid that initial deductible. So every time that you are out of the hospital for 60 or more consecutive days, this first part, the first 60 days, will regenerate and be there for you to start again. But say, for instance, you are not out of the hospital, so from day 61 through day 90 of the same benefit period, you will now begin to be responsible for $371 per day. So that's a daily copay. Same concept applies. Say you're hospitalized for 70 days, and then you go home for 6 months. You're going to start at day 1 and be responsible for a new benefit period. So be responsible for that $1,484. If you're hospitalized for 70 days, go home for 2 weeks, come back, you'll start on day 71 of the benefit period and continue to be responsible for $371 per day. And as you can see from the example, it doesn't matter why you're hospitalized. They don't have to be related. It just has to do completely with being out of the hospital for 60 or more consecutive days. Inpatient hospitalization also includes hospitalization at an acute care rehabilitation hospital. So there's a difference between skilled care and a hospital, but if you are in an acute care rehabilitation hospital, that is considered part of inpatient hospitalization. Now we come to the final 90 days, or day 91 through day 150 of a benefit period. These 90 days are called lifetime reserve days. During this period of time, you are responsible for all, Medicare will pay all costs, but you have a daily copay of $742 that you're responsible for. Now, this portion kind of functions a little bit differently in the fact that we're going to use the example once again. You're hospitalized for 100 days. You go home for 6 months and you come back to the hospital. You're going to start at day 1 and you're going to be responsible for that $1,484 of that deductible because you're starting a new benefit period. But instead of having 90 lifetime reserve days, you have now used 10 of those lifetime reserve days, and you'll only have 80 remaining. Every time you use one of those lifetime reserve days, that's exactly what it means, lifetime. They do not regenerate like the others do. If you're in the hospital for 100 days, you go home for 2 weeks, you're rehospitalized, you're going to start at day 101 and continue to be responsible for $742 per day. Medicare also, Part A, also covers care in a skilled care facility. Now, I want to be very clear that Medicare does not cover nursing home costs. It very specifically will cover skilled care in a skilled care facility, which could be a nursing home. It can also be a skilled care unit at a hospital. For instance, St. Elizabeth has skilled care units at both St. Elizabeth, Fort Thomas, and Florence. But it can also be skilled care provided to you in a skilled care or nursing home facility. So this is also a benefit period. And for the first 20 days, Medicare covers all costs. There's no copay, no deductible. They cover all the costs. For day 21 through day 100, there now is a daily copay of $185.50 per day. That's considered the copay. In order to qualify for skilled care in a skilled care facility, if you have original Medicare, you do have to have an inpatient hospitalization of 3 overnights, so you have to be in the hospital at least 3 nights. You have to require some type of skilled care, which could be skilled nursing care, whether that be some type of wound care, something along those lines, or some type of therapy, respiratory therapy, physical therapy, occupational therapy, speech therapy, some type of therapy that helps you to recover or regain some of your abilities. It has to be ordered by your physician, and it has to be provided in a Medicare-approved skilled care facility or unit. So all those criteria need to be met, and they do case conferences frequently to continue to assess whether or not you continue to be eligible for this benefit, whether or not you're meeting all those criteria and you continue to improve or continue to have benefit from the care that you're receiving, that skilled care you're receiving. Part A also covers hospice care. For those of you that may not be familiar with hospice care is end-of-life care for individuals who have chosen to no longer seek curative care. You do have to have a life expectancy of 6 months or less, and as I said, be not pursuing curative care, but choosing to use those last days to stay as alert as possible, and as free from pain as possible. Most people receive hospice care in their own home, but hospice care can also be provided in an inpatient unit, whether it's in a hospital or St. Elizabeth, again, on the Edgewood campus, has a freestanding hospice facility. But it can also be, if you reside in a nursing home, hospice care can also be provided to you there. The setting does not necessarily matter as long as you qualify for it. So if you have selected hospice care, Medicare pays all the costs, whether you're an inpatient or an outpatient, whether you're receiving those services in your own home or you're actually hospitalized as an inpatient, either in a hospice facility or in the hospital. There is a copay of $5 for any outpatient drugs. You said, I thought you just said that you would not be pursuing curative care, but remember I said that they keep you as free from pain and as possible, and so that certainly could be some pain medications. So there is a $5 copay for any of those prescriptions or outpatient prescriptions that are part of your hospice care. Additionally, most hospice patients have a primary caregiver, particularly those individuals who have elected to remain in their own home. And hospice Medicare does recognize that caregivers sometimes need to get away. And so they provide a respite coverage for respite care, where either you're hospitalized within an inpatient hospice unit or they have caregivers come to your home to provide that service. And there is a 5% of the cost of that as a copay for respite care. One of the questions I often get about this coverage is, what if you live longer than 6 months? And the answer to that is, as long as your physicians feel like the life expectancy of the Medicare beneficiary is 6 months or less, they continue to be eligible for this benefit. If at any time during the coverage it's determined that the individual has regained some strength or gone into remission or whatever the right term might be, but their life expectancy exceeds 6 months, then this benefit discontinues, and that is not part of that. You do not receive this benefit any longer. This benefit does regenerate if you would cease becoming eligible and then become eligible again. You could continue with this benefit. All right, so that's what Medicare Part A covers. Now, Medicare Part B, you remember from Monica showing you the card, is the medical insurance portion of Medicare, and it is funded through general revenue funds, as well as you'll have a monthly premium. So most of the individuals who are new to Medicare in 2021 will have a monthly premium of $148.50. If you receive a Social Security check, that will be withheld or withdrawn from your Social Security check. If you do not receive a Social Security check, you will be billed for this on a quarterly basis. And from this chart, for individuals who do have a higher income, and you can see it starts for individuals at $88,000. I'm sorry, for individuals at $88,000 or greater, you can see the tiers there, and then or a joint filing, $176,000. There is a higher premium. So also you can see from that chart that Medicare will consult your tax return, and in this case for 2021, they will look at the 2019 tax return. It is your responsibility if your income changes. For instance, in 2019, it could be much higher than it was in 2020 or in 2021. It'll be your responsibility to point that out to Medicare so that you can get a reduced premium. So what does Medicare Part B pay for? Well, Medicare, after you have Medicare Part B, after the annual deductible. So remember, Part A was all around benefit periods. Medicare Part B is structured more familiar to most of us in being an annual, and you have an annual deductible that starts at January 1st and then regenerates every January 1st. You'll be responsible for an annual deductible. In 2021, that deductible is $203. After that $203 has been met, Medicare pays approximately 80% of the charge that they approve. So not necessarily what's charged, but 80% of what Medicare approves. And they pay for all physician services, whether that physician provides you the service in their office, in a nursing home, in your own home, or in the hospital. And that sometimes can be a little confusing because individuals kind of expect that if you're hospitalized as an inpatient, that kind of comes under Part A as inpatient hospitalization. But physician services are always billed under Part B, regardless. So for instance, if you have an anesthesiologist who you may or may not have met, or that pathologist that you definitely never met, those will all still be billed or be part of the coverage under Part B. And then all outpatient services, whether it's in the emergency room or your lab tests or x-rays or any kind of diagnostic tests, or outpatient surgery, which practically is all surgeries nowadays, or any type of therapy services. You need physical therapy or respiratory therapy, mental health coverage. Any of those types of services are all considered outpatient services and are covered under Part B. Additionally, Part B covers most home health services, preventative services, and durable medical equipment. When we're talking about home health services, it is, again, very structured as to how you qualify for Medicare Part B to cover home health services. Again, it has to be ordered by a physician. It has to be medically necessary, and you do need a skilled care. So again, you might need to have a skilled nursing care for some type of, again, I use the example of wound care, but it could be something else, or one of the therapies, occupational therapy, physical therapy, speech therapy, respiratory therapy. And you also need to have the inability to get out of your home, that you are pretty much homebound, and it is not something that anybody in your family can easily provide for you to go to receive this in an outpatient setting. So it has to be ordered by your physician. You do need to have all of these, you need to qualify for the skilled care. You have to be homebound, and it has to be provided by a Medicare-approved home health agency. And again, they will continue to reevaluate to ensure whether or not you continue to meet the criteria there. Under preventative services, a lot of the flu shots are always many of the preventative services, if not all of them, are covered without any copay, and they're covered whether you have met that deductible or not. So, for instance, flu shots, a yearly wellness exam, mammograms. The mammograms are covered every 2 years, I believe, and many other types of things. You should actually, we always encourage you to take a look at Medicare.gov and look at all of the type of preventative services that are covered under Medicare. Just to clarify the yearly wellness exam, additionally, that is not a checkup for an pre-existing condition. Say, for instance, you have high blood pressure, you go in to see your physician maybe twice a year, maybe once a year. But if you're going in there to check on an existing condition, that doesn't qualify as a yearly wellness exam. A yearly wellness exam is where you see your physician and you talk about a wellness plan. You talk about, perhaps you talk about your advanced directives. Do you have an advanced directive in place? Talk about what you're doing to keep yourself healthy. Any type of lab work that might be prescribed or requested as a result of that will have copays associated with it. But the yearly wellness exam is considered to be a preventative service, and so there is no copay associated with that particular exam. Same for your Welcome to Medicare exam, which we don't have on there, but you are eligible for a Welcome to Medicare wellness exam with your physician, your primary care physician, within the first year of you becoming eligible for Medicare. Medicare Part B also covers durable medical equipment. So say, for instance, you maybe have a CPAP machine or oxygen or need a wheelchair or diabetic supplies through the mail order. All of those types of things are covered under Part B as durable medical equipment. Another portion of Medicare assignment, I kind of alluded to it when we were first starting. I want to make you aware of something called Medicare assignment. And Medicare assignment is an agreement between your medical provider, and that doesn't mean just physicians. It means that durable medical equipment provider or the hospital or any type of medical provider, physical therapists, etc., between your medical provider and Medicare. And when a provider has agreed to be part of the Medicare assignment program, they accept the payment amount that Medicare approves for the service. And they agree not to bill you any more than your Medicare deductible. Remember that Medicare deductible and or your coinsurance. So they have agreed to accept as payment in full what Medicare approves. Not what Medicare pays, because remember, Medicare pays approximately 80% of what they approve. But they have agreed to accept as payment in full what they approve. So we're going to do a little example of that so that hopefully this is clear. So again, for this particular example, we are going to assume that Part B deductible here in 2021 has already been paid, and now it's $203. So the actual charge, whether your provider accepts assignment or does not accept assignment in this particular example, is going to be $115. The next question, who files the claim to Medicare? Well, regardless of whether the provider accepts assignment or does not accept assignment, the provider files the claim to Medicare. You, as a beneficiary, are not responsible for filing that claim. Okay? So, who's going to receive the MSN? Well, you're going, what the heck's an MSN? Scratching your head. That's a Medicare summary notice. That is how Medicare talks to you, talks to the provider. And so So who is going to receive the MSN? Well, if your provider does not accept Medicare assignment, only you will receive that Medicare summary notice because because they do not have that agreement with Medicare that we talked about. So they're going to send that to you. If your provider does accept Medicare assignment, they have that agreement with Medicare, so both you and the provider are going to receive the MSN. So here's the important question: who does the payment come to? Well, the payment is going to, if your provider does not accept assignment, the payment's going to come to you because they're assuming that you have already paid the provider at the point of service. So they are reimbursing you for that expense. If your provider does accept assignment, that payment goes directly to the provider. So now let's go back to kind of the cost portion. So remember, the actual charge is $115. Medicare approves for this particular service $100. That's going to be their approved. And remember, they pay 80% of what they approve. So in both instances, they're going to pay $80. Now, if the provider does not accept assignment, they're sending that $80 to you. If the provider accepts assignment, they're sending that $80 directly to the provider. So what are you going to be responsible for? Well, if your provider does not accept assignment, you owe the difference between the actual charge and what Medicare pays. So you're also responsible for $35. So again, that's subtract. So Medicare reimburses you $80, and you're responsible out of your for the copay of $35. If your provider accepts assignment, you owe the difference between what Medicare approved and what Medicare paid. So there was $100. They approved $100. They paid $80. You are responsible for $20. So in this particular example, you can see the difference is only $15, and it may not seem like that's a big deal. But if this was a surgery or a hospital bill, you can see that would could add up fairly quickly. So it's a very important concept to be aware of. And it's a question you might want to make sure that you ask your provider, or that you check to see if your provider does or does not accept Medicare assignment. In Northern Kentucky, really almost all, if not all, of our providers do accept Medicare assignment. All the major hospitals accept assignment. All the anesthesiologists and the oncologists and the pathologists, all the ologists accept assignment. Almost all the primary care, not quite all of them, but most of the primary care physicians also accept Medicare assignment. So it's not necessarily a huge concern in this area, but if you are a snowbird, are in Florida, or you go to see a specialist, say Cleveland Clinics or Mayo Clinics, you'll want to ask, because they may not accept Medicare assignment, in which case that could add up to be an additional expense for you. Okay. So, so how can you check to see if your provider accepts Medicare assignment? Certainly, you can ask the office. Make sure you say, do you accept Medicare assignment, not do you accept Medicare? Or you can get on Medicare.gov and go to Physician Compare and see if the provider does accept Medicare assignment. Do you think that, one last thing before we move on, and that is I do want to make you aware that the provider could not just charge you anything, that by law, they can only charge you 15% more than what Medicare approves. So in our example of Medicare approving $100, $115 was the maximum that they could charge you in that example, because that's 15% more than what was approved. So there is a cap on that. Okay. All right, so I do want to talk for a moment about the help for low-income Medicare beneficiaries. This may not apply to you, but it might apply to your Aunt Sally. It might apply to the lady that you from your church that you help occasionally. And so it's just always really good information to be aware that there is help for low-income Medicare beneficiaries. And in this case, the states help pay the cost. There's 3 programs, QMB, SLMB, and the QI1, which I'll explain in just a moment. In order to qualify for these, the beneficiary must have Medicare, at least Medicare Part A, and they do have to meet certain income and resource limits. There is a handout, again, on our website that is more inclusive about all of this, gives you more information. It also gives information about how to, where you go to contact and become eligible. But we'll share a little bit of those guidelines right here on this slide. And these are the guidelines that will go into effect April of this year. So the current guidelines have slightly lower eligibilities. So the QMB program is a Qualified Medicare Beneficiary Program. You can see that there's different, your monthly limit of income is $1,061 for a single individual, and you can see a higher amount there for the married. And same across for the SLMB, which is the Specified Low-Income Beneficiary Program, and the QI, which is the Qualifying Individual Program. You can see the monthly income limits. They also then, you can see resource limits, which are the same regard for all of these programs. The monthly income limits are a little higher. And then when they're talking about resource limits, they are talking about any type of liquid resource that you might have. They're not talking about a home that you have. They're not talking about the furnishings. They're not talking about a car. But if you have a life insurance policy, that's considered a resource. Any, say, retirement annuity or any type of retirement plan that you might be getting, anything in a savings account, CDs, those are all considered liquid resources. So those would be counted in that resource limit. And then you can see what, if you are qualifying, you might say, oh my gosh, Aunt Sally, I think, the only income she gets is her Social Security check. She doesn't get anything else. And I think it's really, it's $1,050, I think. Well, do remember that if she is paying for Part B, that monthly premium for that Part B, that needs to be added back into her monthly income. So just be aware that does. But you might say that's her only, and you would want to pursue or encourage her to pursue this, because then the state will pick up the cost of that Part A and Part B, the premiums and the co-pays and the co-insurances, which can make all the difference in the world for many individuals between actually being able to buy food or prescriptions and be able to have their coverage. I'm going to turn this back over to Monica.
All right, we're going to discuss the Medicare summary notice in some detail. Janellen talked a little bit about it in the last couple slides. So this is what it's all about and what it looks like. So the summary, Medicare summary notice, or the MSN, is how Medicare will communicate with you. The MSN is not a bill. And you'll receive this summary statement about every 3 months, and if you use the Part A or the Part B service, you'll need to review when you receive, and you need to keep it for at least 18 months. You can review anytime your MSN on www.mymedicare.gov. The next 4 slides are going to be the actual Medicare summary notice with tips on how to read the summary. So we're going to go through this. So the very first page, it's called your dashboard. And your dashboard is where you will have your information. So you want to check your name and your last 4 numbers of your Medicare number, as well as the dates of the MSN was printed and dates of the claims listed. So that is number 2. That's in that gray box. Number 3 will tell you if you have paid your deductible. So this summary notice is for the Part A. So they are watching your Part A deductible, and that's when they're going to tell you if you paid it or not. If you look at number 4, that is going to tell you what part of Medicare that the summary notice is. So this sample is just for your Part A. When you're in the hospital, this is all the services you received and what has been billed to Medicare. The part number 5 on your right-hand side, this is the total you may be billed. Number 6 is where you used your Medicare card, and this would be at a facility, a hospital, because it's inpatient. Page 2, this is where you're making the most of your Medicare. So it's going to help you through and find where you are in the notice. The section titles are on top of each page. How to check. Medicare offers helpful tips on what to check when you review your notice on this page. How to report. Help Medicare save money by reporting fraud. It'll explain what the process is and who you need to contact. How to get help. You can find this on this page. This section gives you phone numbers for where to get your Medicare questions answered. And then number 5 on the right-hand side, this section explains the benefit period that they are letting you see who has submitted to Medicare on your behalf. And then they have a general message area. These messages get updated regularly to make sure you check them. Page 3 is your claims for the Part A hospital insurance. So this is where your claims can either be inpatient or outpatient. Definitions that you don't know, they'll have definitions, explanations there. It'll talk about your visit, the date you went to the hospital or facility. Keep your bills to compare them to your notice and be sure you got all the services listed. And then again, it's going to show your benefit period. This shows when your current benefit period began. And then number 6 on the right-hand side, this is your total amount the facility is able to bill you. It's highlighted and in bold for easy reading. And then notes will be referred at the bottom of the page for explanation of items and supplies you got. And page 3, which is the last page, this is where they explain how to handle denied claims. So if you receive a denied claim on this MSN, then you're able to file an appeal. The appeal is in writing, filed by the step-by-step instructions when filling out the form. And you can see it's labeled number 4, and that is the appeal that you would fill in and send off. And if you need help with that, Primewise can help you with that. But no, you have 120 days to file an appeal when you receive this MSN. So it is time sensitive. So once you get your MSN, Medicare wants you to help to prevent fraud and billing errors on your MSN. Did you know you can get a reward up to $1,000 for tips that lead to uncovering fraud? Remember, you are the best defense against fraud, so check your MSN for services or items that you did not get. Your Medicare rights. You have the right to keep your personal and health information kept private. You have the right to receive an advance beneficiary notice or an ABN when providers believe services is not covered. Now, the advance beneficiary notice is a notice saying Medicare probably or certainly won't pay for some services. In certain situations, if you sign this notice and get this service, then you will have to pay full cost. So in this slide, you will see an actual advanced beneficiary notice. When you are going to get a service, if the provider does not believe that Medicare will pay for that service, they will fill in the information in the box. And then what you're going to want to do is read that box on what services they believe Medicare will not do. Ask questions. Why? Why do they believe Medicare won't pay for it? Maybe there are some other steps you need to take. And then you want to read the box G, and it's called options. And you have several options to choose from. So read those options and know what your responsibility will be if you check one of those options. We just want you to be aware. I've actually received this in the dental office. So it could be any kinds of services. So just be aware of this and just ask questions. Your Medicare rights also continue. Medicare and or Medicare plans must provide an appeal process, which we talked about a little bit. You can file complaints or grievances, including complaints about the quality of your care. File an appeal, and you must file that appeal within 120 days of the date you receive your MSN, and that's very important. Again, Primewise can help you in these processes.
All right, so we provided pretty much a lot of information already, and you probably have a fair number of questions. So hopefully you're jotting those down and can certainly contact us for that. But we're going to kind of do an overview here. So you did not hear us mention that any of the items listed on this slide are covered. These are called coverage gaps in Original Medicare. Now, there is no coverage for dental care or dentures or eyeglasses or foreign health care or hearing aids or routine foot care, et cetera, et cetera. Those are not covered under Medicare. And you and I might consider them to be pretty essential, but they are not covered. The only exceptions to this would be, I'm going to use eyeglasses as an example, is if you have, say, cataract surgery, where then the very first pair of lenses after your surgery are covered by Medicare because that was a medical condition. But they don't pay for the glasses, the frames, just the lens. I do want to point out the foreign health care because Medicare is strictly for individual coverage in the United States. Again, a couple of exceptions to that would be if you actually live near a border, near, say, the Canadian border, and the closest hospital is actually in Canada, then they will have alerted you to that and make you aware of that. But if you are traveling, you're going to wherever you're going, say, for instance, even if it's Canada or Mexico or Europe, you need to, if you're going in any structured way, you may want to pick up some medical insurance or trip insurance because Medicare will not cover you while you are out of the country. So just as an aware there. Hearing aids, I think if you are aware of anybody who's had hearing aids, in general, hearing aids are pretty expensive, but again, these are not covered. So, and then there's those benefit gaps. So this is basically a review. So you remember me talking about Part A and how for the first 60 days of that benefit period, there's that deductible of $1,484. So that's a benefit gap. That's something you are responsible for. Then for days 61 through 90, the $371 per day, so a daily copay. And then for those lifetime reserve days, so day 91 through day 150, you have a $742 daily copay. Now, lots of people kind of panic at this point, saying, well, what happens after that? And Medicare does not have any additional coverage, but in Medicare Part 2, we do talk about options that help with that coverage post that. But Medicare coverage does cease after 150 consecutive days without being out of the hospital for 60 or more consecutive days, so that 150. But the one thing I do want to ask you, if you were in front of me, I'd say, how long do you think the average length of stay for a Medicare beneficiary is in the hospital? And most of you would say about 5 days, and you'd be right. The average length of stay in a hospital for a Medicare beneficiary is 5 days. So while we all know people who have been in the hospital much longer than that, it is definitely not the norm for people to remain in the hospital. But these are all part of our Medicare Part A benefit gaps, and also that $165.50 daily copay for day 21 through day 100 in a skilled nursing facility. Okay, Part B, benefit gaps. Well, there's that 20% copay for the Medicare approved charges under Part B. Remember, Medicare pays approximately 80%, so you're responsible for that 20%. That's a benefit gap. And if you go to provider, and this says doctor's bill, but it's really any provider, as I've struck. So if you go to provider that does not accept Medicare assignment, then there's also that benefit gap between the difference between the provider's bill and the approved charge. So that's sometimes called the Medicare excess charge. And then that Part B deductible. So that, remember, that's an annual deductible, $203. So we like to kind of get those figures in your head because in Medicare Workshop Part 2, which is also posted here on our website, we're going to talk to you about those additional possibilities or options for you that will partner with Medicare. Possibility 1 talks about original Medicare, which is what we just spent the last hour discussing with you. And then also picking up a Medigap or a supplemental insurance policy and a Part D prescription drug plan. So that's really, we're going to talk about particularly the Medigap policies and the Part D prescription drug plan as rounding out possibility 1 for you as an option. Or possibility 2, which is a Medicare Advantage plan, in which, if you're familiar with the lingo, is an HMO, a PPO, a PFFS, so health maintenance organization, a preferred provider organization, etc. And those are the possibilities that you hear on the TV all the time. Those are the ones that oftentimes, or may indeed, include some coverage for dental care, some coverage for hearing care, some coverage for vision care. So we'll talk a little bit more in detail about that as an option for you, and then how you go about making your choice. So as resources, you know, you've heard both Monica and myself mention Medicare.gov several times. So you can actually call Medicare at that 1-800 number. We do recommend you call them early in the morning because they can get backed up and you can be on hold for a long time. Or you can also get on their website. It is a very good website. There's a lot of information on there. Then Social Security, there's both the phone number and the website there, because remember, Social Security is where you go to enroll in Medicare. You don't go to Medicare.gov to enroll in Medicare, you go to Social Security. And then the State Health Insurance Program, or SHIP. Here in the state, this is the 800 number, and you will tell them which state you reside in, and they can refer you. Both Monica, myself, and the other Ashley, who is also in our office, we are all certified SHIP counselors. So we're all part of the state health insurance program. So we get qualified in continuing education. So those are all good resources for you. And then Primewise, we are here for you. So please know that's our website, our phone number. We provide these Medicare classes frequently. Certainly, you can get on our website, and individual appointments are available as well. Right now, if you are viewing this and COVID is still, there's still restrictions in place, do be aware that there will be some very stringent restrictions around appointments. But we'll do everything we can, whether we have a virtual appointment or phone appointment, or if we are able to arrange an individual appointment to assist with you. Again, remember, we don't recommend or endorse anything, but certainly we'll work with you. So Monica and I, we thank you. We thank you for watching this Medicare Part 1 presentation, and we hope that you found it helpful. We really, really, really need and desire your feedback, so please click on this link or copy it and put it into your web browser, whichever works best for you. And complete our short survey. We promise you it's not long. It'll take you less than 5 minutes, but we would really appreciate your feedback. And again, you can always contact our office with any questions or concerns about something that may not have been covered here. There's our phone number and our email address. Thank you very much for tuning in. Have a great day.